How much does scoliosis treatment cost? Scoliosis is a highly variable condition that can range from mild to moderate to very severe. And there's also many different types of scoliosis that a patient can develop, from congenital scoliosis to neuromuscular scoliosis to idiopathic. And we also know that scoliosis can affect all ages, and it can affect patients anywhere along their spine, meaning their neck or mid-back or low back. And lastly, is we also know scoliosis is progressive, meaning where scoliosis is today doesn't necessarily mean where it's going to stop in the future. So because of all these things, we know scoliosis can have a monetary cost associated with treating it. But the more important thing to consider is not only the monetary cost associated and how variable that could be depending upon about everything I just mentioned, but also what the end result will be in terms of how it affects your spinal health and well-being. Because the cost in your health and function is by far the biggest long-term effect, because there is never a cure for scoliosis. No matter how you choose to treat it, you're always dealing with the effects afterwards. And this by far, I think, is the greatest cost that you must consider, is how healthy and how well and how functional you're going to be after the treatment that you choose to do. So when scoliosis is progressive, what do I mean? We mean that scoliosis is a progressive condition. It will worsen over time. And where scoliosis is at the time of diagnosis is no indication of where it stay. In fact, we know every severe curve was once mild. So mild scoliosis cases can easily progress to moderate, severe, or very severe, especially if they're left untreated and not treated proactively. So early detection can be very beneficial when it comes to reducing the costs associated with treating scoliosis. But if you detect it early but let curves progress to more severe standards, then the benefit of finding a curve early may not lead to that benefit that you're achieving and the costs associated with it. And we also know as curve worsens and we treat them later on, the end result won't be better. So we're affecting both things at this time if we don't treat curves while they're detected early. Now, we know there's never treatment guarantees, but we do know if scoliosis is detected and treated early, we know there's fewer limitations, like I mentioned, and we also know there's better results at the end of it. So when treatment is started early in this progressive line associated with scoliosis, there's fewer limitations. As curves progress, they become more complex, and as they become more complex, we know that these curves become less responsive to treatment because the curve becomes more and more rigid, and therefore, like I mentioned, the benefits of early detection are only available to patients who actually proactively treat it. So when we look at treating scoliosis, we know there's two main approaches. And approach one is something I like to call traditional approaches, and option two is something I like to call conservative approaches. Now, traditional approaches have their own conservative approach, but those approaches are not corrective in nature, which I'll explain in a second. Traditional treatment options typically involve in trying to just really watching and waiting for signs of continued progression. And they do very little proactively to prevent this progression from occurring. They kind of sit back and say, well, let's see how much larger this curve becomes before we can do anything. So traditional treatment tends to do nothing. And as curves worsen, they tend to react. And the reaction is as curves become more severe and as they now require more invasive treatments, it tends to funnel patients towards spinal fusion and surgery through a reactive response of progression. Now, conservative treatment options, meaning corrective conservative treatment options, normally don't like to watch and wait and see curves worsen over time. They want to proactively treat curves as close to the time of diagnosis, because treating a small curve is more simple. Treating a smaller curve produces a better result. And if we treat these curves at this stage, you'll never have to consider the more invasive treatment like severe spinal fusion or surgery. So therefore, conservative treatments typically combine multiple treatment disciplines. These include things like chiropractic care, scoliosis physical therapy, corrective bracing, scoliosis rehabilitation, home therapy, and all these things are designed to help manage and reduce the scoliosis. Now, when we look at these two options, what are the monetary costs associated with these treatment options? When we look at traditional treatment options, we know the cost will vary based upon number of factors, like the condition of the scoliosis, the severity of the scoliosis, the patient age, the surgeon fees, the hospital fees, whether or not there was any complications associated with the surgery could happen, the length of time needed in the hospital to recover. All these factors factors can change the rate associated with spinal fusion, but we're looking at anywhere between $115,000 to $175,000 to end up with a fused spine. Now, that's the key thing I want you to understand. Yes, it's $150,000 to end up with a spine that can no longer move or bend. So has this high cost associated with it, and then you also have a spine that's not very functional because spinal fusion is removing one of the functions of the spine, which is spinal motion. Now, what are the monetary costs associated with corrective conservative treatment? Again, the final cost will change and range based upon all the things that we mentioned, but we look at comprehensive assessments, we're somewhere between $200 to $300, approximately $300 for a 3-hour treatment session. Say the average person needs 10 to 20 treatment sessions, and we're looking about corrective bracing to be about $3,000, and say maybe some home rehab equipment roughly about $700 to $1,000. And at the end of the corrective stages, you're going to have a curve that's reduced and also not fused. So you have a reduced curve that's still fully functional. So when we look at these monetary costs, we understand that conservative treatment, by all means, it's much less cost associated with conservative corrective treatment or corrective conservative treatment versus letting curves progress and become more serious where you require spinal fusion or surgery. But the biggest cost difference I want to focus on is the spinal health and mobility. We know fused spines are more proactive or more likely to have more future issues as a result of their fused spine. They have more restrictions on life and well-being. They have more likely to develop pain and malfunction. They're more likely to have more spinal fusions and more spinal surgeries in the future. So you spend all this money and still have a non-functional spine. It may be straighter, but it's less functional. The way I like to explain it is kind of like saying you have an arm problem, and instead of correcting the arm problem, let's just fuse the arm together, and now your arm is perfectly straight, but you can bend your elbow. Yeah, your arm is straight, but is your arm really healthier? It can't do what it's supposed to do. Where in contrary, when we do conservative type of treatments, especially when we do corrective conservative treatments that actually can reduce the scoliosis and make the spine straighter, and while still retaining normal motion and flexibility, and it costs less, so you're spending less money to get a straighter spine that's still functional. You can see how these results make much more sense. So what we always recommend is conservative corrective treatment, and then if that fails and that doesn't produce the response that we want, then you start considering surgical options as a last resort. So for me, spinal fusion and spinal surgery should be considered in cases that fail conservative corrective treatment. Now, one thing I want to make very clear is that traditional treatments also have conservative options. Now, but these conservative options are not corrective. They're just trying to slow down progression. So when I speak about conservative treatment options, I'm talking about corrective treatments that are attempting to reduce the curve while maintaining spinal function. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.